to start the recording. Okay, it looks like we are recording. So great, thank you so much everyone for taking some time today to join us. My name is Sheila Rabin. I'm the Orchid US Community Specialist at Lyrasis. Also with us presenting today, we will have Burnett Sherman from Orchid, as well as Jane Scott from the University of Texas Southwestern Medical Center, and also Jason Ranallo from North Carolina State University. So this is our third Orchid US Community Showcase. And what we're going to talk about today is, first, I will give a very brief intro and overview to the Orchid US community and Orchid, just to make sure we are all on the same page. Then Burnett will give a quick global Orchid overview, and then we'll jump right into our case studies from our two US research institutions that are Orchid members through the Orchid US community. UT Southwestern Medical Center and North Carolina State University. And then we will have some time at the end for questions and discussion. So to get us started, just a quick reminder of what ORCID is. ORCID stands for the Open Researcher and Contributor Identifier. It is free for any individual to get their own unique 16-digit number that is formatted as a URI. It looks something like this. This is my ORCID ID. If you were to click on this URI, you would be taken to my ORCID record, and this is kind of a sample of what that looks like. It has information about my name, other names that I'm known as, other disambiguating information about myself, including things like employment, education, works, funding, and there are some other new fields in ORCID records as well for things like appointments and memberships and even research resources, so things like labs and equipment and even collections that may have been used over the course of research. So that's the basics of the ORCID ID and ORCID record. But ORCID is more than just an identifier. It also provides a mechanism for interoperability between workflows and systems in the research and scholarly communication ecosystem. So this diagram kind of illustrates that ecosystem, showing the researcher at the center with their ORCID ID, and then the other stakeholders around the outside, the employers, which are often research institutions, as well as funders and publishers. Those are the three other primary organization stakeholders that are involved in ORCID. And so they can all connect with their affiliated researchers through ORCID and being able to transfer data more easily between the researcher and the stakeholders, and also between the stakeholders. And this is made possible through the ORCID API, or Application Programming Interface. So institutions are building ORCID functionality into their systems using the ORCID API in order to make these connections with researchers through ORCID. And the API can be compared to kind of a puzzle piece that helps different systems talk to each other, even though they may not be compatible. So ORCID kind of serves as that central puzzle piece that allows for communication across workflows and systems. Research institutions are interested in ORCID primarily because of these four benefits. One, the ORCID ID can help to mitigate any confusion that's caused by name ambiguity. So anyone who shares the same name, for example, or who has used multiple names over the course of their career. ORCID data can also be used for assessment at an individual level, looking at individual contributions, but also at the aggregate level, ORCID data can be used to demonstrate and measure institutional impact. Research institutions can also use ORCID to assert affiliations onto researchers' ORCID records. This helps institutions maintain integrity over their name and the metadata that's going back out into the wider research and scholarly communication ecosystem. And ultimately, this is designed to save time and reduce administrative burden for both researchers and administrators and staff at research institutions. And in order for institutions to really get the benefits from ORCID and have a successful ORCID adoption, there are three primary areas of activity that are needed. One is gaining internal stakeholder support, so making sure that all of the key stakeholders at your organization know what ORCID is and recognize the value of ORCID. Two is that technical integration piece, integrating the ORCID API into the different systems that you're using. And the third aspect is an outreach and education to your researchers, making sure that they know what ORCID is and how they can also benefit from ORCID. In the United States, we have a group called the ORCID US Community. This was formed last year as a partnership between Lyrasis, the Big Ten Academic Alliance, the Northeast Research Libraries, and the Greater Western Library Alliance. So these four groups joined together to form a national partnership for ORCID membership at the consortial level. So at this point, any nonprofit research institution in the US can become an ORCID member through the ORCID US Community. And Lyrasis is the administrative lead for this group. This is just a quick visual of what our community looks like right now. We have 114 institutional members all across the US, but of course, plenty of room for growth. And so we're seeing increasing interest, a couple of new members a month, and we're moving in the right direction. So the goal for this ORCID US community group is to really build a community of practice around ORCID in the US, provide some communication channels for ORCID member institutions to communicate with each other, share what they're doing, and this webinar is part of that effort. Additionally, the group also provides a substantially reduced fee for ORCID membership. So by joining as a group, we get a lower fee than institutions joining on their own. And we also have dedicated resources and technical and community support for our member institutions, including several of these community resources and communication channels. We have a website with lots of resources on it at orchid-us.org. And you can also send an email to orchid@lyrasis.org. We're also on Twitter at US Consortium. And for our member institutions, we have a discussion forum that is our primary communication channel. So at this point, I'm going to switch it over. I'm going to stop sharing my screen and let Burnett share hers and give us a quick overview of ORCID at the global level.
All right, thank you, Sheila. Let me share my screen. Okay, so I am Burnett Sherman and I am with ORCID, and my role is sort of shifting to do more member communications and outreach. I was previously the communications liaison for the Americas team, so I'm still going to be quite involved from a different perspective. But from the Americas region, we've seen growth over the past, even just the past few months. We've now got 291 members just in the Americas region and 185 integrations, with 28 of those qualifying for Collect and Connect badges. And then there are 4 consortia, of which the ORCID US Community is one of them, and it's also the largest consortia in the Americas. And there are 193 research institutions across the Americas region. And you can see from that pie chart that most of those are research institutions, followed by publishers being the second highest number of members in our region. So in the Americas region also, we've got, in addition to the US, we've got Canada and Latin America. Canada has one consortia and Latin America has one consortia, but the US does have two, one of them being the Health Research Alliance, and then the other one being this one. And there's 222 members across all of the US consortia and independent, and then 169 integrations. So we're really happy that across the whole Americas region, we are seeing a lot of growth, members integrating with ORCID and getting value out of it, and seeing the value to pass it on to their organizations and their researchers. And just finally, global perspective, there's over 6 million ORCID IDs right now. They have been issued and people are using them. There's 21 total consortia. There's over 600 integrations total. And we're now at over 1,020 members. So we're really happy to see the growth, because as we know, the more users, the more connections, the more integrations, the more value and the more use everyone can get out of it. ORCID is best when it's used in conjunction and used together with others. So we're really happy to see that growth and what the Americas are doing, as well as what the US consortia is doing. So that's all I've got for kind of an ORCID perspective, but we're growing, we're connecting, and it's because you all are making that work, you're making those connections, and you're making it happen, and you're doing the work at the ground level. So thank you.
Wonderful. Thanks, Burnett.
Thank you.
All right, next up, we're now going to hear from Jane Scott at the University of Texas Southwestern Medical Center. Jane, if you want to share your screen, perfect.
Okay, can you see me?
Yes, looks great.
Okay, great. So I am going to be talking today to you about how our campus initiated our own ORCID integration and the promotional strategies. And probably the two questions that are prominent, and one in the beginning and one now is the first is, can you get UT Southwestern listed as a trusted institution in ORCID? That was the question that kind of started this whole ball rolling. And it sounds like a very innocent question, but as many of us who are doing integration are through that, it's actually not an easy question. It's actually quite an involved question, because it involves an integration strategy. So, but when we kind of started that, it was very innocent from our administration, saying we just need to be a trusted institution in ORCID, and can you get that going? So that's what started the ball. So I'll be talking to you about basically from that question on to where we're at right now, which is the second one of why I'm probably presenting today, is because we are proud to say that we've had over 2,000 on-campus ORCID ID holders registered just in our first 3 months of ORCID integration. And that's a great milestone for us, but it didn't come just spontaneously. It came from a lot of careful planning. So I'll tell you kind of some of the key components of why we got that result, and how you may be able to adapt that to your own strategies. So the first is administration and administrative support. We talked about that, data integrity, divide and conquer strategies, effective promotional strategies, the library-centered ORCID portal, permanent strategies for registration, and then how to encourage ORCID usage for sustainability. So the administration and administrative support, I can't say how strongly that factors into our success. If we were just a library deciding to implement ORCID and just hoping for the best, we would probably have numbers in the low hundreds. But because we were able to get it administratively supportive from the deans, higher VPs down, we really got a lot of valuable kind of green lights about things that would probably have taken a long time if we tried to do that independently. But I think what's really important about ORCID that isn't always stressed in the kind of promotion aspects of it, but it's really central to getting institutions to buy into it, is the ability for it to potentially relieve administrative burden for accreditation and grants reporting. Our graduate school, for example, is funded largely by grants, training grants. And so every student that we have, we are tracking 5 to 15 years out to see how they did, what the return on investment was. And it's an arduous task if you don't know who these people are, or that's that legally that graduated that year and whatnot. So, so when the administration realized that an ORCID ID could potentially alleviate that arduous process that they're doing right now, they became very interested in this. And this was actually what kind of led the chase for ORCID, for our campus, was that. Not wonderful ORCID lost the ideals, but really it was a matter of, man, you mean we could just type in a number and get this person and not have to cross-reference their PIs and all this kind of stuff. So the long-term value tracking was really an important component that got administration on this very quickly and gave us the green lights that we needed to for our students, postdocs, and clinical trainees. And potentially, I think, we can't ignore the fact that, if we don't use Influent Pure anymore, things like that, it could potentially be a replacement for faculty stuff as well. But for right now, we're focusing on learners. But that is a huge factor that brought this about, but it's also something that we really had to deep dive into to make sure that we could deliver what they were expecting. So, So the first question I kind of mentioned about that, can you make us a trusted institution? That was something that the integration strategy sounded like something that would be really easy. We just get this designation, whatever that meant, and then people can just type in their 16-digit number into our PeopleSoft HR, area, and we'd be done. But there's some real issues in terms of that in regards to data integrity, the manual entry of that. But that was initially what was on the plan from this administration. And so we really had to, instead of just say whatever you say, because we knew that that couldn't happen in a trusted institution capacity, which we needed, and that the integration strategy is really what would also be most valuable in dealing with these future goals of being able to find people's information 5, 10, 15 years out. So that integration strategy required us to really actually kind of school a lot of our administration on what it is, how long it would take, that there was a commitment with it. There was a lot of things that needed to be addressed, and that not everything was planned out in terms of, yeah, we just throw it in PeopleSoft and that'll work. Well, there isn't currently a PeopleSoft integration. ORCID would like to work with us on that, but we also had some challenges with that because we had a major redo of PeopleSoft during the time that this was requested, which is why the library got it in the first place, because IR was really in that. So that created kind of a divide and conquer strategy that we really needed to kind of assess the environment to see, one, is this something that we're taking on just because IR is busy right now, or is this something the library wants to really own because it has the potential of bringing that added value for our own sustenance and our own sustainability, and also what we do, and how we assist our communities with citations and all that kind of good stuff. So first we kind of needed to do an environmental scan. I was really naive about what the integration would take, so I had to really learn really quickly about what things were available in our campus, what we needed to do, what we were going to have challenges with, and then determining the expectations and desired deliverables. What things could IR's data warehouse provide for us? What would be a reasonable expectation for the education administrators of the medical school or the graduate school? What kind of support could they bring in terms of enrollment in ORCID, is it really a sustainable process and things like that? What could our training and development provide us for long-term training so that we aren't heavily reliant on a busy administrative professional to try to track down 1,000 medical students or 1,500 medical student records every, initially, but throughout the year, and a postdoc population that comes in monthly. So we did need to also kind of get a sense of what were people expecting from this, because like I said, it did come in as we get data for the future. So what was the administrative support looking for? So for example, something that became clear was what was really important for the citation listing is that they had author order. And that doesn't come with the ORCID record. It comes with Scopus or Web of Science, but not with the ORCID record. So we kind of had to really say, okay, how will we then, figure that into the plan? Because ORCID can't fix everything, and ORCID record itself is not going to save the world in some of the ways that people want it. So we needed to kind of make that sense. And then we also needed to dispel myths and unrealistic expectations. I mean, there are really some admins that were like, once people register for ORCID, we're set 15 years down the line. No, they could do nothing with it. They could register and do nothing with it. And then we're at zero, like we've been all along, you know, just with a number and nothing else. So we really had to dispel some of the myths about like just getting an orchid means that you're, you know, you've fixed everything, but you have to use your orchid. You have to populate your record, and making sure that we really identified opportunities along the way of the research cycle for our campus that would encourage that and also promote it and provide it. So those things really had to be weeded out, because if we just set up this integration plan and then people are like, where's the orchid? Where's everybody's information? Because they didn't realize there's a lot of individual initiative that needs to be taken with that. Then, you know, we're not doing anything and we're upsetting people. So this was the initial kind of mock-up that I put of all these different entities that were in place that could potentially work in with what ORCID was at this time. And this is a rough list, and it's not where we ended, but it kind of shows you all of the potential challenges of navigating all of these different stakeholders. And every single one of these boxes, we communicated, our library staff communicated with them to determine what they could provide, what they couldn't provide, what if they even needed us. You know, for a while we were really heavily based on PeopleSoft and what they could do with us. We had a lot of difficulty contacting them, but then we actually found out that we didn't even need them, and we could house a database in our library server and communicate with the EDW, which is our data warehouse area. And PeopleSoft didn't even have to be part of that, and they loved it and we loved it, because then we didn't have to worry about this area that was going to be very difficult to navigate, because we actually have learners broken up into campus solutions and HCM on this PeopleSoft thing. So there's a lot of complications in trying to figure out what field to put in there, and a lot of confusion and frustration. So the fact that we could remove that actually was really helpful in us moving forward, so that we could potentially do that in the future, but for right now, we could still get the project moving with the deadline that we had set. And then we also have this influent peer area, which takes care of faculty, but it doesn't take care of students. And there's some potential there, but again, there might be some potential that it doesn't stay around. You know, resources come and go, funding comes and goes, and things like that. And we have also a faculty profile system, which is a marketing system that also displays people's information, but it is done by administration and updated by them. So we also had these conflicting things that already exist on campus that we were either going to compete with, supersede potentially, or, you know, just happily coexist with. And as well as all of the specific schools that we have, graduate school, medical school, and also School of Health Professions, that have their own timelines and things like that. So this was kind of the initial blueprint that we worked from. And then this is where we ended. We basically said, okay, everybody here, you register, you go through the library's registration page into the database. That will be pushed into our EDW system, which then can be pushed and generated into PeopleSoft with the information, with person numbers, basically. So we do LDAP authentication on the registration page through there. And so that system, you know, works, smoothly with what we need to do. So that was a really valuable way that we did that. So, and I'll show you really quickly what the registration would look like, which is, so you're going to go in, you're going to create and connect your ORCID ID. If you have an existing one, you go in through there. You can also check with the ORCID site if you don't. This is a portal that's located on our library's website. I'm going to hyperlink there. And then you'll go in your LDAP authentication. So, authorizing that you're currently UT Southwestern affiliated. That also grabs the person number. So we have an identifier for that ORCID ID. Then you create or connect with that link, as well as some verbiage about what a trusted organization is, and what, kind of stipulations people know beforehand that we worked with Sheila and Bernadette about. And then it'll go in, obviously, you create your ORCID account, or you automatically will go to this confirmation screen if you have one and you're logged in. You authorize UT Southwestern, and then if they say no, I don't think so, because maybe they didn't read the whole deny aspect, then we say why it's important that we do this, and denying it will actually not allow you to, be able to get that requirement from campus. We don't get that information if you do. So we give them some information and say, can you possibly reconsider this? And if they do, or if they automatically approve it, then they'll go to this confirmation screen with a link to their website. to their Orchid account, and then some resources on this left that we've provided, PDF handouts, as well as our portal and homepage. They have more questions about Orchid, how to populate things, stuff like that. So that's how that strategy looks. So in terms of promoting this, so we've got this integration strategy set up. We're good to go. We're excited. And initially, what people kind of do is they'll put a web banner up, or they'll kind of, if you build it, they will come. We have an Orchid at UTSW prominently in that Orchid green that has a pull down of registration, Orchid facts, tutorials, and then also, and this one here, this might be an older, and then Orchid login page too, for people to go directly to Orchid. So those are the pull downs for that specific area. So that was our kind of initial promotion strategy. We did that for probably about 2 or 3 weeks. We also included a library news article, which goes to about 800 registered people, mostly people that have registered for ILLiad, for our interlibrary loan system. And then we also had a campus update where we kind of recycled that content onto a campus update that's sent out to an email to all university employees. And then from there, we also had created handouts and email templates. So this was a handout that, along with an email template that each school could modify, that basically introduced that this is what we have an Orchid requirement now that we're doing, and here are the steps of what you need to do to create it. And this is kind of the little PDF handout to shorten that. And it was sent by the school dean. We did not send. It wasn't James Scott, the digital services and technology manager from the library, which people would probably not care and do not think it's that important. But if Dr. Galindo, the head of the medical school and education area of the medical school for scholarly activity, is telling it to you, it's going to carry a little bit more weight. So we work with the administrative people to get that sent out on behalf of the deans of those various schools. And so that's kind of was that second approach where we're actually emailing people individually, utilizing the administrative education schools, groups and cloud. And then what we also did was create a mandatory campus requirement. So we are in the process of putting together a policy that says that you are going to, all learners, which is postdocs, clinical trainees, and students, are required to register their Orchid ID with the campus. And then this is the model medical school training, where they say you're required to complete all this training until they learn, which is our online training module for the campus, and Orchid account creation is one of them. And so that's an additional kind of creating this clout where it's a policy that is that is required on campus and not just a suggestion. So in terms of the success of marketing strategies, here's minus 2 weeks ago. It's just when we finished that calculation. There hasn't been a lot of movement, frankly, in the last 2 weeks. But so in terms of the success of each one, when we started the web banner, we started that at launch. And you can notice that basically we got maybe 20 people by just having a web banner. The library news article produced a little bit of a jump with that, which is fine. The campus update then produced that initial kind of boost right here. But if we're looking right here, really with all of these efforts, which is generally the traditional efforts that, again, libraries will get, we probably got 60 people. But this is when we started sending out the medical dean email. And you can see by the yellow, there's definitely a big push in registration initially with that. And then the postdocs also sent out, their dean sent out an email. And so you can see there's a huge push. These are the schools that were primarily focused on just doing an email only campaign. The graduate school was opting, they understood that we were going to have a more formal training happening. And because their students are in for a longer duration sometimes, they only had to focus on the graduates leaving. So they actually did not implement this, but they are actually our kind of guinea pig, as well as the School of Health Professions, for the second phase, which is utilizing our training module. So that's why they're absent from these, because they had very small numbers, to zero numbers, frankly, and for School of Health Professions. And there's about 60, but the 60 for graduate were directly related to an email push from their administration saying, you're graduating, register for an Orchid ID. So But anyway, but you can see that there's huge jumps, over 180 just in, just over a 2-day period from the postdocs, and then, some steady kind of roll of 10, 20 here again. The clinical training, GME, Dean sent out also an email right around mid-February, and you can see, although it's not reflective in the yellow and green, but the clinical trainee link, which there's a whole story of why we don't have that link there. We're trying to determine the numbers for it. It might be more or less than it is. But you can see the huge spike independent of these two, about 120 clinical trainees registered within a 2 or 3 day period. Probably more like over 200 actually, when that push was made. And then the second medical school, we had a second email sent out in a month later that says, hey, you really need to register. And we were able to pull from our database those people that had not registered yet based on the PeopleSoft data that we work with the warehouse, the data warehouse with. So we were able to strategically, give them the list that then they could send out to the people that had not registered yet. And so you see a big spark of, over 180 attendees within a couple of days because the medical school had sent out a more forceful second email. And then again, a third spike a month later with that. So right now we're seeing, pretty substantial numbers with those email alerts. Very minimal things with generic articles and things like that. So working with administration and administrative professionals and giving them the tools that will allow them to do that has been really, key to them. So I mentioned the portal. Here we go. Here's the more recent one bit. That has, the information about what ORCID is, with a video from the ORCID's website, YouTube channels, things like that, Vimeo. We also have a frequently asked questions section, as well as tutorials that are all links, again, to ORCID resources rather than creating our own things. If it ain't broke, don't fix it, is our motto. And this is really helpful to kind of link people to those resources that ORCID provides. And we also have created our own ones that can specifically target maybe areas that our participants and our students and scholars and things might be utilizing, as well as specific registration, which is that PDF you just saw. So creating an ORCID culture on campus is a really important component to this, right? You want to make sure that that you have that the campus is acting and not just talking and saying, hey, do an ORCID, we're not going to do anything with it, or they don't use that. So ways that we've been trying to encourage that is first, from the library's perspective, since we handle the institutional repository, we're now making it mandatory that you have to have an ORCID ID to submit anything for content. So that means a lot of the medical students submit posters, or a lot of students, postdocs, can submit their works, and any thesis or dissertation will need to have a mandatory ORCID ID now, so we can capture all of our graduate students and some medical students that fall under that category. Because they have to submit to the institutional repository. So that's a way that we can make sure that we are, that we are supporting that cause. I also do academic poster template consults. It's a big part of my job and has been for the last 10 years with people. So I created a campus template, since we don't have one, and I included this ORCID section right here. So people think, oh, I guess I have to put an ORCID on there when I do that. So we're just reinforcing the value of ORCID, and that we're an ORCID institution, and that, when you're dealing with scientific publications and medical publications and academic publications in general, that putting your ORCID ID is going to be a standard that we, appreciate and expect. And that was just a choice made because I created the template. So there wasn't anything, other than that. I also make sure that I include it in courses about, in the academic poster class that I teach, I do mention, okay, and what do you do, after you've completed your poster, you submit it, you put it in your ORCID record, and here's how you would maybe input it into your ORCID record, to kind of show that with a link. So it's also a promotional opportunity at the end in different courses of how you might want to include that. If people are doing presentations, I also include it there. That's just that extra component of reporting, your work, now put it in your ORCID record. So kind of creating that kind of thought process. And then I also just included an email signature. As you can see my email here with the ORCID link to my content right here. So doing that and encouraging others to put it on there, on their CVs, on any web pages for their staff, or faculty pages. And then something that we are working for the future is a CV generator using your ORCID record. I think this can be really powerful because everybody needs CVs. And if you could populate your ORCID record and then potentially like log in so that it would be somebody that has created an ORCID account with us, that they could benefit from having their record pulled to create a CV. So if they needed it for an internship or a residency, any sort of thing that falls under the grants, stuff like that, that they could potentially use that. And it's something that the university is working on with some of these other, with some of these other ones, like the faculty profile on the left, focus on faculty. They've been wanting to do this for years. So we see an opportunity to potentially do that and show that added value where the only benefit to doing that CV generator would be, or not benefit, but the requirement would be that you would have to populate your ORCID record. So that's just kind of a way that we can ensure that from happening. And that's all that I've got right now. Any questions?
Wonderful. Thanks, Jane.
Sure.
I think we're going to hold any questions until the end. But yes, if people do have questions, I would say go ahead and type them into the chat. That way we can reference them towards the end of the hour. And we have one more presentation, and that will be Jason Ranallo from North Carolina State University.
Hi, so can you hear me?
Yes, I can hear you and I can see your slides.
Okay,
Perfect.
So hi, I'm Jason Ranallo. I'm at NC State University Libraries in the Digital Library Initiatives Department. And if you'd like, this is a copy of my slides and their speaker notes, and you can find a link to the slides at the bottom of every slide I show. So this is our technical integration. Just want to share that up front. Feel free to take a look around there. But where I want to start, though, is showing you basically what I show to faculty. This is where we start as far as our outreach hook. And I want to start with this question. How do other researchers find you? Every researcher wants to be found, so I tell this little story. If someone starts looking for you with a search engine, then they're likely to find your NC State profile page like this one. And when they scroll down the page, they'll see this block of recent site publications. And if they scroll down a bit further, they can click through to all known publications and see a page like this with a longer list of your works.
Jason.
And faculty, yes.
It seems like we might not be seeing additional pages. We're just seeing the title page.
Just seeing the title page. Okay, sorry about that. Let me stop sharing and try to share again. Do you see an updated?
Yes, I can see a profile page now with words.
Okay.
Perfect.
And okay. So publications on the page. Okay. You're seeing things update?
Yes,
okay.
Thank you.
Great. Okay. So faculty may not know that this data comes from the libraries and that we maintain it, but they are interested in keeping this data current on their department profile page for attracting graduate students, current awareness of activities in departments, and generally improving the discoverability of their work. So a little bit of history. We've been harvesting citations of works of NC State University affiliated people for 10 plus years. And the libraries has provided an API of these citations, which are included on some college and department faculty profile pages via WordPress plugin. Okay, so what's this got to do with ORCID? We've been doing this for a while and really wanted to see how we could better serve researchers, how we could have more complete data, more reuse of this valuable data, and more user control. So you can begin to see how ORCID fits in. So we began with some targeted outreach on our existing services and adding Orchid into the promotion mix there. We wanted to start small to scope the work and hone the message and our services as we went. We started with groups who we knew were already using this data in some way, who we could show some immediate benefit to. And so the answer to who were the most receptive users are who are using this publication block on our directory pages. And this includes some of our largest colleges like engineering and agriculture and life sciences. So we really needed to scope in even further. And Liaison Librarians helped us to narrow this down to just a couple groups we could start with. And so we ended up starting with the Wilson College of Textiles and the Crop and Soil Sciences Department in the College of Agricultural and Life Sciences. Liaisons on the team worked to get us invited to faculty department meetings. And the relationships and the knowledge that the liaisons brought really helped get us to receptive, interested groups. And increasingly, we're getting invited to departments now via word of mouth. Someone takes advantage of our services and then advocates to have us come to a department meeting. So this is an interesting side effect of interdisciplinarity on campus too, as some have heard about all of this in one department or cluster meeting and then ask that we get invited to another department that they're also affiliated with. So for department meetings, we try to adjust our message for each department. For instance, the profile pages we show are the ones from their own department. Often someone with an updated profile who's signed up with us uses their Orchid ID. And so it's more work, but I think it's been more engaging to do this kind of targeted pitch. So some of the things that we've developed is as a template that we can then customize for each of these presentations. We find the journals that departments publish in the most. We can then tell the department about the Orchid requirements and recommendations of those specific publishers. And liaisons have been helpful in identifying which are the journals and publishers to highlight. They'll often know who among our faculty is, say, an editor of a journal, so we can show that as an example. And just a shout out to hopefully a new effort of the Orchid US Community that's kicking off soon to help better collect this kind of information about publisher requirements around Orchid, which would definitely be the kind of thing that would help me find the examples that I can use for this kind of targeted pitch. And then, if the department's getting lots of funding from NIH or NSF, we talk about biosketches and the Science CV integration with Orchid. And we come back to that story about discoverability. Another route to find out more about a researcher is through publisher pages and PDFs, which include Orchid IDs. But they're not going to include other URLs that allow you to learn more about the researcher. So we show an example of an Orchid ID linking from a publisher site to an Orchid record, and I try to show an example from someone from that department. And then encourage them to make it easy for someone to find you. And while you're at it, boost the work of your graduate students by having them use their Orchid IDs when they publish too, and get them set up with their researcher identity. So initially, we did outreach and we talked about our services and explained Orchid. And we sometimes do this in combination with talking about research impact metrics, as this is sometimes the initial question from the department, and the way that we've gotten in to be able to talk about Orchid and how it fits. But increasingly, we've been asked to come and first and foremost do a quick session to get everyone to register by connecting their campus ID with their Orchid ID and taking advantage of our services. So we've developed a very short tutorial to get folks signed up quickly. And one of the things that we talk about in this is how Orchid auto updates work. These are the opportunities to talk about the ways in which scholarly communications are changing and how they can take advantage. And we tie this back to the local context that provides some of the more immediate benefit to faculty. If they connect their Orchid ID with us, then they now have local auto updates for their local profile pages as well. And this shows a bit how all the pieces fit together and why we're asking them to take this action. So in department meetings, not everyone brings their laptop to it, even though we ask department heads to encourage their faculty to remind them to bring their laptops. So we've also provided this handout we've developed for some of our more general ORCID outreach. And I'm showing this handout because it shows kind of two sides of our outreach. We're promoting ORCID and having folks connect their ORCID ID with the libraries. And we're also promoting library services around ORCID and works. The biggest message we have is that we ask folks to register their ORCID ID with the libraries in order to unlock services. This is why they're so eager to invite us in and take their time in department meetings to get registered. And I'll get to some of what those services look like in a moment. But first, I want to show how simple the sign-up process is. In our tutorials, we start at the home page and folks click on the Get Started button. But before I show the process, I want to also show the other way that we're catching users to connect their ORCID ID. If they're currently affiliated with the university, then we show this message on their current list of citations. So someone comes to their own profile page, sees this unsightly red box, and wants it to go away, so they sign up. Hey, we'll take it. So the first thing they do is they log in with their NC State Unity ID via Shibboleth. And since January, let's see if I can get this to play. Since January, they can make authenticated connections between someone's NC State Unity ID and their ORCID ID. And we've made this process nice, and it only takes a few minutes, even if you don't already have an ORCID ID. And it looks like this video is not playing. But once you sign in to ORCID here we go. In a pop-up window, you authorize our integration, and that's it. And just with this, we can harvest their work, employment history, and education from ORCID, and they're ready to begin using our services. So once a user registers, they can get access to an individualized dashboard. Here we show users the services they're eligible for. So we can show different users different sets of services. And I mentioned the targeted outreach we're doing earlier. We can also tie that targeted outreach to targeted service development and discovery through this dashboard. We'll be looking at other opportunities to target services to particular groups. For instance, we could decide to offer different levels of our CV service to different groups of people. We could be partnering with the department to improve coverage of, say, their technical or extension reports, and so offer a different flavor of the CV service to them there. And we'll be looking for other services that we can add here as we go along. And we want to use this as a way to help level up users in their use of ORCID over time. Yeah, and so the biggest encouragement that we've had for asking folks to connect their ORCID ID with us is to take advantage of library services. So we ask faculty to do something small in order to provide them and the university with lots of value. So this is an overview of some of the benefits we provide, including updating citations on their department pages, filling gaps there, and then helping to bootstrap their ORCID record. And these are some of the specific services tied to those benefits. We continue to do Web of Science harvesting and have now added these other services. So, okay, one of the challenges for any system of record is getting faculty to input their information. And we've wanted to remove that barrier for getting started with the citation index and ORCID. So in order to fill gaps in works we know about, we've developed a CV service. Send us your CV and we'll take it from there. We use citation parsing and some other tools to deduplicate and save us time. Student assistants are doing most of this work. And this develops out of a lesson I learned from one of our liaison librarians, Alex Carroll. There's often a delay between when we do outreach on anything and when someone would need what we're offering. In this case, Orchid. So how do we change that adoption curve? And we think that's about, because the benefits of Orchid could seem less immediate, our strategy for increasing Orchid adoption and use has been to ask faculty to only take a few steps, a few minutes. And since we're not asking them to do much, they don't have to believe us about how much Orchid may benefit them and how it will save them time. They can just thank us later when it does. Another service we provide is we look for DOIs for all known citations for users. We use the Crossref API for this. While DOIs have only been a thing for a short while in the history of the journal article, DOIs have been issued for older articles, conference proceedings, and chapters now. Publishers are issuing DOIs for more of their back catalog, and you can see here a DOI from 1667, well before anyone had any notions about resolvable persistent identifiers. And so once we find that DOI, we can automate other enhancements like searching for open access copies so that we're showing how to get immediate access to the faculty members' work. And we're looking for other ways to supercharge these citations with other available data through the DOI. Once we have this structured citation data, we can create a more easy to read representation of the citation, as well as easy to copy citations in various formats. And you can see here that one of the sources of this citation is from the user's ORCID record. So we're collecting this data with the end goal of feeding it into ORCID. When we first developed our services, we were asking for delegate access, I think called trusted individual access, to update ORCID profiles. And we updated a lot of ORCID records that way via Crossref metadata search. That was a great way for us to just get going, test some of our ideas, and then look to automate those services later. And we've since integrated with the API so that we can push citations to ORCID. Currently, we're only sending citations with DOIs since we know they'll collapse if there is an existing citation with the same external identifier. So in this project, we've learned some about what it means to embrace open data. The whole ecosystem around open data and open citation data is developing, and ORCID is a real key to that. We're using different open data sources to get more done faster than we could have years ago. So this is a really good time to be doing this work. But embracing open has also meant that we're now using multiple different sources of data and having to change how we approach the work. We've been really moving from a model of authority control to allowing our researchers more control, following the same principles as ORCID. And part of embracing open has meant dealing with a lot of messiness. Citation data all around is messy. Citation standards are confusing to people. Every data source gets details wrong or incomplete all the time. And we've seen how we in the libraries can do this work quicker and at less cost than asking all of our faculty to do it with less accuracy. I'll say lots of credit goes to the developer of our citation handling work, Luke Ashleman, for developing clever ways to deal with these challenges. So one other piece I wanted to show is a bit about how we're communicating with faculty. When they submit their CV to us via the forum, we ingest the citation strings into the citation index application and begin working through them. And having all of this data together in our application means that we've got a number of different ways to easily chart our progress. We can see who has recently signed up. We can see how many users from different departments have signed up. And what I'm showing here is we can show users the progress we've made for them in our CV service. And we can show this on that individual dashboard that I showed earlier. This allows us to get back to them sooner than we might have been able to otherwise, exposes the effort that we're putting into this, and lets them see as further progress is made. And soon we'll be including here a count of how many citations we've added to their ORCID record for them. And faculty are appreciative. We had champions for the service, word of mouth is spreading. We're getting invited to department meetings for groups we hadn't done any intentional outreach to. And I want to mention our partner on our ORCID membership is the Office of Research and Innovation. This relationship has been really crucial for getting us invited to other high-stakes conversations on campus around research infrastructure where the libraries can help. It gets us a seat at the table. And so our work with ORCID is part of us thinking strategically together about how to support the complex challenges that researchers have. We've got a number of goals going forward. One that I'll just pull out is that as someone in a technical department, one of the great things about this work is that we've developed relationships, a network with IT and administrative assistants in the colleges and departments, which has been key to the success of it, as well as opening up possibilities for how to work with them in other ways. This is the core team working on this, including liaisons from research services. We've got representation from our acquisitions and discovery department, who have long been doing the citation harvesting work, and members of digital library initiatives as well. And then we have this larger growing support network within the libraries for this work. These are the liaisons who are not on the team, who have worked with us to get meetings with departments, and some of the advisors that we've had who have been helpful at all stages of the work. They've been particularly helpful in honing our ideas and gathering support for the effort. And this doesn't even cover everyone who in a liaison role has been involved in email correspondences with faculty. And we've met with our public services staff to know how to refer questions to us. So there's lots of involvement from across the libraries. Okay, that's what I got.
Wonderful. Thank you, Jason, and thank you, Jane. So now we do have a few minutes for questions, and I see that we have some questions in the chat. So let's take a look at those. The first one is a question about wondering how much resistance from faculty is coming up in terms of mandating or asking them to create or connect their ORCID IDs.
This is Jane. I actually haven't encountered any, but I think that the reason why is because the more that you can clarify what ORCID is and ORCID isn't, the less faculty will have problems with it. I think any resistance that I found initially from anybody had to do with misinformation or lack of information. So they assume, for example, ORCID is a social media platform. They assume it's a proprietary online system that's going to bombard you with emails and things like that. So they take it to the realm of social media in terms of privacy and things. And I think taking that conversation back to the reality of what it is, and that most people welcome it because it clarifies their contributions. And I don't know of a lot of scientists and doctors that don't want their work noted, I think the more that you connect those dots about what it's not, and ORCID does have some good resources about that, the more that you don't get any resistance. And if anything, you get more people saying we should have done this early on. So that's been my experience. So, yeah,
when I'm in department meetings, we'll often get a faculty member just saying, well, I'm not doing that. And I'm saying, that's fine. We don't have to. And questions about the difference between ORCID and Google Scholar come up a lot. And what's funny is end up seeing them register, take advantage of our services after, further along into the pitch. Could be a day or two later that we end up seeing them show up. So in the end, there hasn't been like unhappy resistance.
Okay, that's good to know. Okay, the next question is for Jane. How many FTE in the library are dedicated to the ORCID endeavors there at UT Southwestern?
Yeah, so it is a duty as assigned for sure. So I would say I'm the project lead of it for the campus. So I handle a lot of the stakeholder aspects of it. I'm communicating with all the education, coordinating training components now with our mandatory training things. I presented on the policy form to get it being, so a lot of that, it's really making a big part. But then Desmond Ho, who's our web engineer 3, is an integral part of the website, and also the database. So he set up the integration system and did the sandbox a compilation and everything like that. So he's a huge part of that back end stuff and some of our future enhancements. So I wouldn't say it's a primary part of our responsibility. It certainly took up a good 2 to 3 months getting it set up and organized from that. But the goal is to set up kind of systems where you don't have to be constantly on them. So that I would say is not a full-time requirement at this point. We do a monthly report on who doesn't have resources. So and then we also have like Jason mentioned, we have a lot of stakeholders in there. We probably have over 10 IR people that we communicated with at some point, mostly saying that it's not their job or they're not going to do it. But so we kind of whittle down to those key components of people that are going to be utilizing it. And then we also, from the education side of all this kind of recruitment and promoting things out, we probably have 3 to 4 designated people for each one of the learner communities. So that's postdocs, grads, medical, and whatever that we're working with on that. And they're people that are also linked with scholarly activity within their own education school component. So those are the primary parts. And then we have had tremendous benefit from having my boss's boss. So the VP that handles all the deans, for example, if I'm getting slowness from them and he's saying we need this done, then I will CC him on that email and it gets done a lot faster. So there is benefit from that high up with that. And we've had amazing results with Patricia's question that's kind of coming up about utilizing, the people at high level that really want this. We got amazing results in servers and things like that we would have had weeks and months if we didn't kind of play that card. So that's been integral, is having the academic high-level dean support for kind of recognizing that this isn't the library bugging you. This is like something you need to do. So that's kind of our breakup with it. Long question of it.
Awesome. Thanks, Jane. Jason, did you have any feedback about how long it took to do the integration, or how you kind of got the work prioritized?
Yeah, so as an initiatives department, we're able to spin up new initiatives quickly when we see the opportunity. I'll say that the kind of like developer technical aspects of it were able to happen rather quick. I think the thing that wasn't clear to us when we began, and this is the thing that I would share with anyone who's approaching an implementation, is I think if you look at the guidelines and what ORCID will review to validate your implementation, you'll have a better idea of how to estimate how long it would take you to achieve it. It was something that we weren't aware until we had dug in and started an implementation. And so I think that would have helped us better estimate the amount of time it took.
That's a good point. Yeah, ORCID has a production checklist, basically, where they'll review certain things to give you your production credentials. So yes, looking at that ahead of time is definitely a good idea. Jane, did you want to add?
Sure, yeah. Our longest part came with determining what we're going to do. Once we did it, the integration part was actually pretty quick in terms of, of that part of it. I don't think we handled any major issues on the integration side. It was the infrastructure of the university of how are we going to use PeopleSoft? Are we going to use our IR warehouse system? Do we want to take some ownership for it? That came about not deliberately, but from necessity. That's a door that's going to be closed for 6 months if we choose to do a PeopleSoft integration and be a pilot for ORCID. Or we can do it literally in 2 weeks if we house that database, and then we can migrate it places if we need to in the future, depending on the technology advancements that come about for those projects. So it's kind of weighing the odds of, as an institution, do we want to sign up to be a guinea pig here? Do we have the reliability here? So there was a lot of what was initially thought of as just put it in PeopleSoft. That was the biggest piece of that puzzle. And it came about of just how can we get this done and have the most flexibility to be able to migrate, because we don't know if our systems are going to be solid. So where is our best sustainable bet for for what we need to do? and for how we need to go about doing it. Because the larger piece of the promotion and everything, we needed to have some control over that too, I think, in hindsight. And I'm pleased with our strategy because it allowed us to have the control of really seeing what kind of enrollment was looking like and stuff like that. Because that's a little challenging to get from our stakeholders. And that's where the slowness happens. And a lot of times we say, like, here it is, and IR is not going to take that on. So the more that we were ahead of the game and asking for what we needed from something and being the head of that integration strategy versus expecting IR to kind of make that happen, but really see them as a partner than as an initiator, I think it sped up our timeline a lot more because we were getting, a lot of delays from initially just giving it to like, oh, let me give it to the IR data warehouse people. And they're like, and really dragging their feet. So I think that timeline happens when IR doesn't want to do the project management of it. So the library taking that on, I think, can speed up that process sometimes. Because if it's just opening up a portal or something, that's different than literally having to be a project manager for somebody's things. So those, I think, that sometimes slows it down because the library might just decide that we don't want to deal with that, But I think there are resources and, that you can talk to about ways to maybe know what to ask for.
Yeah, and I'll just echo that, yes, we approached the integration in the libraries because we wanted to see ORCID advance. We're ready to make our data available to anyone on campus who wants to use it, and so that environment might shift over time. Right now, it's really important to us because it integrates with the services that we have provided for a long time, as well as to ones that we can see providing in the future. But yeah, a lot of that decision was about how agile we could be in advancing this.
Yeah. And that, like the infrastructure that you had, we don't have in our library, so we really have to rely on the individuals. But down the line, if we get the faculty in on that mix, it's possible that all the data they have from Influencure and things like that could potentially fuel that much easier. So, so sometimes it's just the ripeness of certain areas and recognizing if you want to get the learners, which are harder to track down, then we can't make that expectation of what publications they have because most of them don't. So yeah, depending on what population you're going to focus on is kind of a starter. Some people start with graduate areas only or postdocs, faculty. I think that can also dictate where you want to go with it and how involved you need to be as a library and in those departments in order to get the results that you need, for that.
Yeah, I think these are two really interesting examples then for about finding where your leverage is for being able to advance things. And, we didn't have, it might come around to something like upper level administration doing promotion or some sort of policy, but that wasn't a place that we could start with.
Mm-hmm.
Great, thank you both. I do recognize that we are going a little bit over, so definitely anyone who needs to leave, feel free to do that. This will be recorded. There is one more question that I see, Jason, you've answered in the chat, but maybe you want to speak just for a minute about the who's kind of funding the ORCID membership at NC State and discussions around which stakeholders would take the lead with the ORCID stuff.
Yeah, I think what I'll add is that it was really important for the libraries to not be in a position where it looked like we were the only ones who were pushing ORCID, and so it was super important to have partners on campus who also understood the value and were interested in advancing things. And so a lot of it was about further developing the partnership with our Office of Research and Innovation. And so, they went in, they saw the value and went in on the membership. And especially when, we're already getting the Lyrasis discount, the ORCID US Community discount, and then split in costs, it's, no brainer.
Great, thanks, Jason. Okay, are there any remaining questions or comments that people would like to voice at this time? All right. Well, great. Thank you all so much for coming. I hope you enjoyed this webinar. I hope it was informative and has given you some good ideas. I will be sending out the link to the recording as well as the slides probably later today. So if you registered, you will get that email. And as you can see, we have the communication channels there on the screen. There's an email address there, orchidus@lyrasis.org. If you think of any questions later or want to find out more information, feel free to send an email to that address. And so thanks everyone again, and I hope you have a great day. I'm gonna go ahead and conclude.